I am an occupational therapist by training, but chose to go further and get further training in the area of low vision to understand different, visual conditions and frustrations that folks have that deal with vision impairment. So I'm considered a low vision occupational therapist or a certified low vision therapist. And I've been practicing here in the Louisville area for about 12 years. I started out at the low vision clinic at U of L, and when that dissolved, I decided to continue my services here in the community via private practice. So I partnered with different eye care professionals in town that already knew me to, generate referrals and relationships so that people could continue to get my services. And then I also provided, low vision services at the Cincinnati Association for the Blind and Visually Impaired. And that kind of serves the Cincinnati area, obviously, but also, Northern Kentucky, Florence, and the Covington and some of those areas. So I've spent a majority of my time here in Louisville and in Kentucky. And it is low vision is the only type of therapy that I have ever practiced. So I'm obviously passionate about it and really enjoy it. So low vision is a vision impairment that cannot be corrected by your standard glasses, contacts, surgeries, or medications. So they cannot be corrected back to normal vision. And the most common conditions, that cause low vision are age-related, and they include macular degeneration, glaucoma, diabetic retinopathy, and cataract. And that comes from the CDC. That's, the most common diagnoses here in the US. And then although there's, treatment for cataracts, some people don't have access to that treatment. And so they do then experience low vision. So maybe their insurance or cost or just their lack of awareness that there is a treatment. So that's why cataract is on the list, even though, there is a treatment out there for it. But that, macular degeneration is the condition that I see most commonly. But yes, something that can't be corrected with, you typically are used to experiencing the eye doctor, glasses, contact surgery, or medication. Most folks have, a general optometrist or ophthalmologist that they see on a regular basis, maybe yearly, maybe sooner than that, depending on the condition. And, that person should hopefully refer them to low vision services if they see that need or they hear, the frustrations that their client or patient is having. Now, that doesn't always happen. The general or, your retina specialist, he or she may be, really focused on treating your condition and making sure the health of your eye, everything that they can do is being done. And sometimes, they don't have time, or they may just not be aware of the services that are available. So the hope is that they would refer, but it doesn't always happen that way. And so it's also important to advocate for yourself. If you are having frustrations due to low vision, or someone that is, it can be helpful to seek out that low vision specialist, whether it's an optometrist, occupational therapist, or other state provided services. You can always contact them, and most of them will then contact your, eye care professional just to make sure the team is all on the same page, to make sure that you get the services you need. So hopefully your doctor would do the referral, but if not, don't hesitate to advocate, and us low vision specialists will help you out too. It's definitely a team approach. But like I mentioned, in the beginning, I am an occupational therapist that has chosen to go further in my education to understand this realm of low vision. There are also optometrists and ophthalmologists that do the same thing. Typically, it's an optometrist that will do an extra residency or go further with their education to treat low vision conditions. So the model that I'm obviously most familiar with is within the medical model. So that would be a team of an optometrist and an occupational therapist. And what I mean by medical model is that we can bill insurance and we have a healthcare background. So the ideal situation would be that the patient would see a low vision optometrist. That optometrist would then recommend follow-up care with a low vision occupational therapist. The main difference, beyond, our education is that we are looking at functional vision. And that is, how does your vision affect your day-to-day life? The optometrist would, do a thorough assessment and recommend equipment that might help maximize the vision. And then ideally, the occupational therapist can continue with that assessment of vision, because a lot of these conditions are progressive and we want to be, keeping up with what's going on. Then we can dive deeper into the goals. We can provide training on the equipment that the optometrist has recommended, and then, go further with lighting, appliance use, things that happen in the home, safety, technology, and organization has been a big piece for a lot of my patients lately. Just simplifying their environment has helped them greatly. So again, like I said, my most familiar relationship is between a low vision optometrist and low vision occupational therapist. But there are lots of other team members out there that it can be important to know about, such as orientation and mobility specialists. They help and ensure safe travel, whether that's on your feet, on a public transit, using a white cane or sighted guide. They do all of that training for someone that's visually impaired. They're also certified vision rehab therapists, certified low vision therapists, and certified assistive technology specialists. And these professionals may not have a medical background, but they've all dedicated their time to, learning how to assist people with low vision adapt. And they can't bill insurance. So a lot of times you'll find these services provided through state and federal programs or just private pay programming. So lots of good people out there that want to help. And there is, some overlap, obviously, amongst the professionals. So it's, okay to see us all, to get all of our ideas so that you can do the best that you can day to day. The exam's going to vary a little bit depending on the professional. But again, we're looking at functional vision. How does the vision affect that person's day-to-day life? They're going to use special charts that can actually get a little bit more of a detailed acuity, and that's the number 20/20, 20/30. We have some different calibrated charts that help us in low vision. We're also the optometrist is going to do a different refraction. It's going to be a trial frame refraction. So typically when you go to your optometrist, they put a phoropter in front of you, which is the machine that they put in front of your face that they can switch lenses and test whether you have a glasses prescription. A low vision optometrist is going to put the old time frame on your face, and they are going to manually take lenses in and out. The reason why they do that is they can make bigger jumps as far as the prescription, and also the person being assessed has a larger area to work with. So they can, if you have central losses or peripheral losses, that trial frame gives you a better chance to use your side vision, turn your eyes if that's what allows you to be successful. So they do kind of a more thorough refraction based on a person having low vision. And then they're also going to look at things like contrast sensitivity. That's your ability to see something on a background. They may also screen or test your visual field. That's your side vision. And then they're going to be interested in your goals. What are the things that you need to achieve or that you're frustrated with because of your vision, and introduce different equipment that might help maximize that or might help with the goal. Now, typically dilation doesn't happen because when an eye doctor dilates, it takes away your focusing system. So then we can't really look at reading and magnification. And so it's always important to have your general eye exam. For someone that has low vision, they need to have that general eye exam for the health and treatment of their condition. And the low vision specialist or optometrist is an addition. And then typically for a low vision optometrist, they're going to recommend you follow up if you have a vision change, you follow up if you have a goal change or a new frustration, or maybe on a year or two basis. So it's not something you have to do every year necessarily. And then, like I said earlier, it's ideal then that the low vision optometrist refer to myself, and in a kind of initial exam with me, I'm going to test some of those same visual things. I'm also going to test reading because looking at letters is different than looking at words and sentences. I'm going to look for that kind of sweet spot, sweet size that they need. I'm going to train on some of the equipment that might have been recommended. And then we're going to dive deeper into more goals that, maybe occur at home. And one of the big things that I find really important about the OT experience is the ability to go to somebody's home, see their lighting situation, see their safety situation, see what kind of organization might help them or decluttering might help them, and see how they perform with the equipment in their own space versus in the exam room. So all those things can be important, and I've had the privilege to go to many people's homes and provide service, and I think that's really the best way to provide my service. And insurance and Medicare typically gives the occupational therapist, I can ask for a certain number of visits, or I get a certain number of time to achieve those goals. So we can have multiple sessions, which is nice and helpful. So macular degeneration is going to affect that central vision. It's going to affect reading. It's going to affect seeing faces. And there's just a lot of distortion. They may see wavy lines, etc. So, I'm definitely going to take a look at magnification and lighting. Technology is because there's good contrast in devices. We may look at telescopes to see the television or to see faces coming at a distance. So those are some of the major things that I hear with the macular degeneration. Then with glaucoma, it affects your peripheral vision. It affects your mobility, and you might bump into things. A lot of times they experience glare, and they can also have difficulty with reading depending on what their visual field, how big or what shape or size it is. They need assistance kind of managing that new field. So again, mobility, some glare, some reading with glaucoma. And then diabetic retinopathy kind of puts the two together. It can be, a central vision issue and a peripheral vision issue. And the treatments available also tend to damage some of the vision sometimes to kind of stop the progression. So they have a lot of distortions as well at near and far. They have a lot of difficulties, low lighting situations and dim light. Also tend to be a little bit on the younger population. So driving becomes to be an issue, along with all of the things I mentioned with macular degeneration and glaucoma. But again, it's dependent on, the person and what frustrations they have. And so I've worked on everything from setting your stove to reading your checkbook to surfing Facebook to see family and friends. So, there's lots we can do, and it's really endless. The professionals available, in the Louisville area and throughout Kentucky are limited. So there are a couple of part-time optometrists in Louisville that have low vision experience. Same, in the Cincinnati area, there's the Cincinnati Association for the Blind. And then, there is a resource in the Lexington area. and in the Pikeville area. As far as professionals, there's someone that comes to, Southern Indiana that will also work with folks out of the Louisville and Kentucky area, but sometimes it's tough.